Life for Beaumont began 60 years ago with a mission to develop a hospital to serve the growing population in Detroit's northern suburbs. The vision was extraordinary: to establish a private practice, not-for-profit medical center that would deliver high-quality care, always focused on the patient with an eye to teaching and research, and supported by community philanthropy. In the 1940s, Beaumont's founders secured a parcel of donated farmland at 13 Mile and Woodward in Royal Oak. Soon, property from an adjacent undeveloped subdivision was added to allow for future expansions, room to grow.
The founding fathers actually began the work in the late 40s after World War II. And their dedicated efforts, with time, talent, and money, helped create the hospital authority that developed William Beaumont Hospital. Here from the Articles of Incorporation in 1949, the founders set the tone for what is being realized today. And I quote, "To care for the sick and indigent, the aged and the poor. To operate hospitals and clinics for the treatment of the sick. To construct laboratories and facilities for the study of the cause, prevention, and cure of disease, and to educate and instruct youth, and to operate schools." So you see, the vision was always expansive, much more than a single hospital. It was, and still is, a three-part vision of clinical care enhanced by medical education and research.
Ground was broken in 1953 for the new hospital, but the original name, Oakland Hospital, led to confusion. Mail and even a load of bricks intended for Oakland was delivered to Oakwood Hospital in Dearborn. It was suggested to name the Royal Oak Hospital after Dr. William Beaumont because Woodward Avenue was part of the original Mackinac Trail that ended at Fort Mackinac, where Dr. Beaumont pioneered research on the human digestive system.
And so in January 1955, the 238-bed William Beaumont Hospital opened its doors. The very next year, the hospital trustees determined that Beaumont was becoming much more than a local community hospital.
Beaumont has always been as successful as it has. It's because of the foundation that has been established.
At the very beginning of all of this, the physicians that were here had the idea that, yeah, we're maybe now a small community hospital. We can be better than that. We can provide better care to patients. How can we do that? Increase in research, education, all across the board.
Growth came quickly. Residency programs in 1962, the Research Institute in 1966, Beaumont's first open-heart surgery in 1967, the first kidney transplant in 1972, and in 1977, the Troy Hospital opened its doors, making Beaumont a multi-hospital system. Beaumont was well on its way to fulfilling the vision to become a major medical center. Employees knew they were part of something special.
When I started here at Beaumont 40 years ago, I learned quickly how this was about the patient, the staff, the physicians, all the caregivers, all connected with everything flowing to get that patient in, taken care of, and out the door.
But not just the medical staff, it's administrative support as well. We've been very impressed with the fact that administrators not only think about the finances, but they think about quality. And the quality of care is what keeps Beaumont going and always will into the future.
To meet growing demand, expansion continued. The critical care tower, the cancer and imaging centers, the research building, and the heart center. And then in 2004, the South Tower, leading to the birth of the Beaumont Children's Hospital. In 2007, Beaumont Troy, also bursting at the seams, broke ground on a larger emergency center, critical care tower, and a Beaumont Bridge linking Oakland and Macomb counties. That same year, we welcomed Bon Secours to the most respected team in town as Beaumont Grosse Pointe, and soon, Beaumont One was in the air, taking us to patients in need of trauma care throughout Michigan. Medical innovation, led by Beaumont doctors, has been our hallmark. From the nation's first closed-chest heart valve replacement to pioneering surgery to treat urology disorders and other numerous minimally invasive techniques. Beaumont doctors are setting new standards in care. Beaumont was first in the world to offer advanced CT-guided radiation treatment, first to reduce outpatient oncology treatment from 7 weeks to just 3 days, and among the first to develop cardiac breakthroughs in the use of stents and angioplasty.
Why in the world would you go anywhere else?
Thanks to gifts from generous donors, that commitment continues in education, innovation, and research. Our scientists are trailblazers, looking for ways to predict and detect disease earlier. That legacy lives on in a new generation of Beaumont doctors who learned from the very best through our medical school, the Oakland University William Beaumont School of Medicine. This commitment to our patients has earned Beaumont national recognition. Beaumont Royal Oak is routinely placed among America's best hospitals according to U.S. News and World Report. And in 2014, the hospital ranked as the #1 hospital in Michigan. Our nurses are second to none. Both Royal Oak and Troy hold the coveted Magnet designation. It's the highest recognition for a nursing organization earned by less than 1% of American hospitals.
You must have a team. You must have a team. And that's not just your nursing staff, that's your medical staff, that's your unit secretaries, your lab folks, everyone.
One of the big things about nursing that makes it so worthwhile is that no matter what kind of a day you have, whether it's a terrible day, whether it's a busy day, whether you go home tired, or no matter what, the bottom line is you're taking care of people. And because you're taking care of people, it makes it all worthwhile.
And basically, the patient is the center of all that we do, the patient and their families.
From its first days, Beaumont has received significant financial support from community and business leaders and generous individuals. This spirit of giving allowed us to invest in the latest facilities and most advanced technologies while remaining on the leading edge of patient care nationally. Advances like these, made possible by visionary gifts, will take Beaumont well into the future.
Philanthropy has always been an important cornerstone for Beaumont becoming what it has become. Beginning with the founding fathers who really gave of their own time and talent. Since then, millions of dollars and thousands of donors have contributed in small and large ways to clinical education, teaching, and research. We simply could not have and would not have done what we've done today without that wonderful support.
Through the years, we have never lost sight of our core mission to provide the highest quality health care, one person at a time, with dignity and respect, regardless of place of residence or financial circumstances.
It is the heart of that mission that will continue to inspire our new and exciting voyage as Beaumont Health. Together with Oakwood and Botsford, we are echoing our founders' goals, growing into a stronger regional healthcare organization with employees who understand serving with compassion and dignity.
When people ask me what is the biggest single thing about Beaumont that makes it so great, it's people. It's always people.
Beaumont Health now encompasses 8 hospitals and 154 outpatient sites of care. With 5,000 physicians, 33,000 dedicated employees, and 3,500 volunteers, all committed to healthcare as magnificent and meaningful work.
In its 60th year, Beaumont has captured the vision of our founders with an international reputation for groundbreaking research, innovative medical education, and for the delivery of high-quality, high-value care, where the patient is always at the center of what we do.